For the goal, the patient exhibit an oxygen saturation level within acceptable parameters. For the equipment, oxygen delivery device as ordered by the healthcare provider, oxygen tubing, humidifier if indicated, sterile water for humidifier, oxygen source, oxygen flow meter, appropriate room sign. For the implementation, bring the necessary equipment to the bedside stand or over bed table. Next, perform hand hygiene and put on PPE if indicated. Next, identify the patient. We can identify the patient by looking at the door tag, the wristband of the patient, or by asking the patient what is her name and her birthday. And also, we can check the patient chart. Close the curtain around the bed and close the door to the room if possible. We don't need to lock the door. And also ask the patient if she wants to close the curtain. Explain to the client what are you going to do and the reason for doing it to the patient. Review safety precautions necessary when oxygen is in use. We can place the no smoking sign to appropriate areas such as out sa door or even sa gilid ng patient. Next, connect the nasal cannula to the oxygen set up with humidification. If one is in use, adjust the flow rate as ordered, and then check the oxygen is flowing out of the prongs. Next, place the prongs in the patient's nostril, place over and behind each ear with adjuster comfortably under chin. Alternately, the tubing may be placed around the patient's head with the adjuster of the back or base of the head. Place gas pads at ear beneath the tubing as necessary. Adjust the fit of the nasal cannula as necessary. Tubing should be snug but not tight against the skin. The patients to breathe through the nose with the mouth closed. Ma'am, my name is Cez Reyes from NUST, and for today po, I will be your student nurse. Bibigyan ko lang po kayo ng oxygen ngayon as ordered by your doctor po. Kayo saglit na itaas po yung ulo nyo. Okay lang po ba? Okay po. Ma'am, pikit po yung mata. Yan. Lagay ko na po yung mask, ha. Ma'am, masikip po ba? Okay lang po ba? Okay po. Higpitan ko pa po ba? Yan. Then, make sure natin na yung pinaka-tube niya is nakababa. Okay po ma'am, try po natin na i-close yung mouth natin and then hinga po tayo sa nose lang po. Nahihirapan po ba kayong huminga? Na-irritate po ba kayo dito? Hindi naman po. Okay po. Then after 8 hours, we need to check the patient if okay pa yung tubing, nakakahinga yung pasyente, and kung merong irritation sa skin ng patient natin. Then next, reassess the patient's status including the respiratory rate, effort, and lung sound. Note any signs of respiratory distress such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. Ma'am, okay naman po, nakahinga po kayo? Okay po, check ko lang po saglit yung lung sound niyo, mama. Nahirapan po ba kayong huminga? Sige po, mama. Check ko lang po saglit. Okay po. Sige po, ma'am. Sige po, ma'am. Rest po kayo dyan. Then, notify niyo po kami if mayroon pong problema. Sige po. Then, remove PPE if used. Perform hand hygiene. After performing hand hygiene, document. Put on clean gloves, remove and clean the cannula, and assess the nearest at least every 8 hours or according to agency recommendation. Check the nearest for evidence of irritations or bleeding.